You might be wondering, why and how does neuroplasticity-based practice work? My experience is that neuroplasticity-based tools are effective for most chronic pain conditions, irrespective of where the pain is located in the body, how long you have suffered, or how severe your pain is. This is because chronic or persistent pain is created by the brain, not the body. The pain itself is caused by neuroplasticity, the brain's constant capacity for change. And there's a saying in the field that anything that neuroplasticity can cause, neuroplasticity can heal. I'm often asked whether a neuroplasticity-based approach can work for intermittent problems like migraine headache or irritable bowel syndrome pain, and the answer is yes. Many of my patients have had significant improvement in these pain types. After a while, with consistent practice, the symptoms just don't come as often or as severely. Another frequent question is about osteo or rheumatoid arthritis. These are cases where clearly there is body damage, tissue damage, let's say. So in the case of osteoarthritis, there are acute nociceptive signals coming from the damaged tissues, say a sore knee. A neuroplasticity-based practice will not heal the tissues. However, by turning down the volume on pain processing in the brain, the pain severity due to the arthritis can be considerably decreased. This is why there's a very poor match between the severity of arthritis in joints as seen on X-ray and MRI and the perceived pain. In the case of rheumatoid arthritis and other inflammatory autoimmune conditions, it's known that central sensitization can be driven by the tissue inflammation. It's now acknowledged that up to 30% of people with painful autoimmune conditions also develop fibromyalgia, a result of this turning up of the volume of pain processing in the brain. Neuroplasticity-based practice will not heal the tissue damage or the inflammation. However, nociceptive signals will continue traveling from these tissues to the brain, but a neuroplasticity-based practice can turn down the volume on pain processing and decrease perceived pain. So even though the tissue damage remains, pain is less and quality of life increases. If at any time you develop a new, different, or more severe pain than usual, please do not assume that it's being caused by your brain. Please consult your primary care physician. For brain pain that comes and goes, moves around, and causes chronic misery, fibromyalgia would be a key example of this. A neuroplasticity-based daily practice can have a profound impact on both physical and mental health and quality of life.